In Canada, eating disorders affect an estimated 2.9 million people, touching lives in every province and territory, from bustling cities to small communities coast to coast, including my own life as a teenager. Anorexia, bulimia, binge eating disorder, and other specified feeding or eating disorders impact people of all ages, genders, and backgrounds, often hidden behind perfectionism, control, and shame. 1.4 million Canadian youth are among those struggling. Hospitalizations for children and youth have risen sharply, with over 18,740 admissions between 2010 and 2023, many spiking during the pandemic. Tragically, eating disorders carry the highest mortality rate of any mental illness, between 10 and 15%, and only about 10% of those affected receive appropriate treatment. Today, we confront this hidden crisis, explore the latest research, treatment options, and real stories of healing. Our special guest is a leading expert with over 40 years in the field, founder and clinical director of the Eating Disorders Foundation of Canada, Dr. Robbie Campbell. Thank you so much for coming on the show today and talking about this very important issue.
It's a pleasure to be here, and hope we can bring a few extra thoughts to everybody out there so they can kind of address it in their own way.
Absolutely. So let's start off with, let's just break it down and say, what exactly is an eating disorder, and can you explain it in simple terms?
Keeping it simple, it is a problem that people have with eating. That's very simple. However, when the eating becomes a main focus in your life, and you can't really get rid of it, and it sort of encompasses everything and keeps you off track, prevents you from getting on, interferes, and is very life disturbing. That's what an eating disorder is.
So, what are the most common types of eating disorders, and what are their main symptoms of each?
Well, you mentioned it off the top that the main ones we're talking about are anorexia and bulimia and binge eating disorder, and there are others out there. But actually, eating disorders is kind of a spectrum.
Hmm.
It's not that you go through life and might have one. You might have all the different types from this point in time to that point in time. So I like to refer to it as a spectrum. Chiefly, the anorexia is restricting food
Hmm.
chiefly, and they will over-exercise and they will take their weight down because they're so concerned about body image and utilize the eating to try to maintain some semblance of control. Binge eating disorder is when you can eat larger quantities of food and bring food up constantly.
Hmm.
This is up to two or three or four times a day, and this goes on, and you can imagine the side effects that come from it. And binge eating disorder is sort of the third area, and that's where people can't stop eating. They're kind of preoccupied. This is the only way they get satisfied somehow. They can't control sorts of things, and they have a tendency maybe to put on too much weight. This
Hmm.
kind of thing. They end up in bariatric surgery. They end up in doing a whole
Hmm.
bunch of different things and going on diet after diet after diet, and it makes things worse. And it is the most prevalent of all eating disorders and the one that we've neglected the most.
Wow. I know for myself, the sliding scale is definitely real. You're reading my own life story, because I was anorexic and I slowly became doing anorexia, and then I go for periods of binge bulimia, and then I just became fully bulimic within a 12 to 18 years of age. So I understand that. So we've got 50 seconds left. Who is most at risk of developing an eating disorder? Are there certain age groups, genders, or backgrounds that are
Yeah, I
more
think that's
commonly
why
affected?
we've jumped in and addressed those that are just graduating from high school to university. So there's a whole transition period of leaving home, leaving the stuff that's there, moving on to university. So that age group between 16 and 24 has skyrocketed
Wow.
basically since COVID. And with the social media being so prevalent, we've
Mm.
got some devils on our tail that are accentuating this as well. So that age group in particularly is vulnerable, but it starts when you're 4, 5, or 6. You got to be attuned to it a little bit. It can impact anybody, and it can be there right till old age.
We're talking with Dr. Robbie Campbell, and we're talking about eating disorders of all kinds. So, Dr. Campbell, how are eating disorders generally diagnosed? What are signs a doctor might recognize, or a therapist? What would they be looking for?
Well, I'll tell you what. It's not quite as easy as that because people keep it inside. They're a little
Yes.
frightened to come forward. They don't talk about it. And traditionally, doctors don't ask about it.
Hmm.
So it's kind of like a hidden secret.
It
And
is.
I think we have to get by that. We have to get by that somehow, educate those that are treating and educate the public out there. We have to do a better
Yes.
job of awareness, and we have to do a better job of having families acknowledge that it's a major problem. It's not just you got to eat or just got to don't eat. It's
Right.
not as simple as that. So
I
docs
know.
have to be trained to look at it. I mean, you know from your experience, and thank goodness, I think the most valuable thing is for you to be talking about it too, because those with lived experience can help more than
Yeah.
anyone.
Yeah. So, what does treatment for eating disorders usually look like? Can you walk us through the main approaches used today?
Yeah. So when you're starting out and you're a child, you go through the child and adolescent program, and there's family-based therapy.
Mhm.
Traditionally, that's it. By the time you're 18, though, you're cut off. You're cut off. They don't do family-based therapy. And then the adult therapists don't think that the family therapy is there because they want to go through this control change period, get them
Mm.
out of the parents' sort of direction and into their own. And yet, some people can't do that.
Yeah.
It has to be different strokes for different folks.
Right. Yeah. I mean, how does an eating disorder typically affect the family home dynamic, since we're talking about that and how things can change? And why is family support, like, let's really talk about that. Why is the family support so important to recovery?
I think it's very important because you can see it coming. If you got to look and see, okay, family dynamics are there, right?
Hmm.
For with everybody, it's a little different. You can't say, well, this person would respond to this kind of family therapy and this one to this one because everything is unique and different. Often there's a history of trauma. Often
Hmm.
there's a history of mental illness in the family. And folks with eating disorders, it isn't just the eating disorder. They have to deal with anxiety or
Yes.
depression or
Hmm.
PTSD
Hmm.
or substance use or ADHD and a host of other things like
Right.
OCD or autism.
Yes, a lot. So, what are some of the most
It's
helpful things family members can do then to support someone who is struggling with an eating disorder? I know my own parents, when they recognized it, they are like, we have to make sure we watch you eat. And of course, I just became terrible and hidden. And that's really how I started getting into bulimia, because then I'm like, you're going to make me eat, I'll just throw it up. But tell me
you,
some of the ways.
you've put it out there perfectly. That should be encapsulated because no, the number one thing is to listen. Listen. That's what I tell anybody who's a therapist or anybody who's a family. Listen. You have to listen, and you can't be confronting
Mm.
like about the food. You can't be confronting about dynamics. You can't be comparing one child to another child or
Right.
comparing you to the rest of the people out there. How did they do in the soccer game? How did they do in the football?
Mhm.
You got to be careful because you can't be criticizing. You got to be cautious not to criticize because they interpret things wrong. Because then their brain is a little bit starved and they kind of aren't functioning 1,000%. So it's very difficult. So the comparing part, being critical, is that, and food talk, you got to stay away from, and body
Mhm.
talk, you got to stay away from body talk. The whole
So,
business of body image is horrendous.
So what are some ways then for a family to learn to communicate then? Because it's such a challenge, because you're seeing this loved one wasting before you and you're like, what can I do?
It is. We all got to start early and listen to the child's needs. What is it that they're interested in? We got to be careful not to direct them into what we think they should be interested in. We
Right.
have to be able to observe them as they're growing through. What are they good at naturally?
Hmm.
Are they drawn to? we have to pay more attention, I think. Everybody's got such a busy schedule. Everybody's here and there, and sometimes the child gets left out. And then it sort of sifts and sifts, and they go through anxiety, depression, different kinds of things. They
Right.
get teased at school because they withdraw. All these different things happen, and they're getting struggling with their relationships. The parent has to somehow be there for them to be able to support them, not be critical of them.
Welcome back. We're speaking today with Dr. Robbie Campbell, the founder of Eating Disorders Foundation of Canada. Okay, so what is the Eating Disorders Foundation of Canada, EDFC, and how does it describe its role in supporting people across the country?
Well, took a look at this because there wasn't enough emphasis. There was no funding. A lot of other mental health, mental issues were
Mhm.
being funded, were being researched, were being able to be treated for long periods of time, and eating disorder folks weren't. So the number one aim of setting up the eating disorder is to try to address the needs in research, the needs in education, and the needs in treatment. And so we've kind of focused on those things and looking at that. And we finally find out and say, well, okay, one of the biggest things right now in the moment is treatment, access to
Mm.
treatment. You go and it takes like almost a year to get assessed. It takes another year to start treatment.
Really, that
And by
long?
then,
Is that
that's how
fairly
long it's
common?
taken. Well, it's common in this area, but
Wow.
now they're trying to get it down to 3 or 4 or 5 or 6 months, and
Mm.
what it is, if you have a program, there's a tendency to want one size fits all. There's a
Yes.
tendency to wanna put you into a program with others, and it doesn't work. No, we have to establish an individualized kind of
Mm.
program. So you come in and what are your needs? Because if you've got OCD and you've got depression and you've got the eating disorder, you go about managing that differently than if
Right.
you've got necessarily the substance abuse or you've got the post traumatic stress. You have to bring in your own individualized team, like a mini ACT team for everybody. So it's a
Mm.
customized approach. Nobody's doing that. The
Wow.
other thing that I should mention is that they have a tendency to want to treat just the eating disorder symptoms with this particular program.
You mean
Well, you
still
can't
to this
just
day? I mean, I'm no longer in my teens. Well, a long time ago. But that was the problem back when I was a teenager. I assumed it must be much better now that you wouldn't be just treating the symptoms because my eating disorders had nothing to do with the symptoms.
you got it. You're saying exactly how it is. Do you know what? How sad are we? We haven't been
Yeah.
able to move forward very much at all. And
Wow.
now we're just getting to the point of realizing, look, we got to treat the whole person. It's just not one little tiny piece of the person because you start playing and trying to treat this particular person and you do this and do that, then the other thing goes sky high. You got to have a
Yeah.
balanced approach.
So, what personal and professional motivations drove you to shift from clinical practice and research to founding a national organization focused on hope and recovery?
Because I think I'm still involved with treating. I'm still the psychiatrist. I'm still the person seeing people that are assessing them because I love working with people. I like
That's
people,
wonderful.
and
We need more
I think
people
if
like
we can.
you.
So I think we got to find where is the joy in that person? What do they love doing?
Yeah.
What's life all about? What's happiness? We got to focus on the happiness factor and get people through some of these things they're going through. And don't
Oh,
forget, we have to
yeah.
deal with everything from genetics on. And yes, all those things are included. And yes, when you ask the question about how do you treat them, there's a whole bunch of things you do. There are different medications we can use. There are different therapies we can use. Every way thing from cognitive therapy to behavior, the behavior therapy kind of thing,
Hmm.
dialectical behavior, interpersonal therapy. It goes on and on and on.
Hmm.
But no one can say that this is what you need until you see you, until you understand you, and try to get to the bottom of things and what your needs really are and what life to you is all about, and try to put
Mm,
together a personalized team for you to help orchestrate your
love
way
that.
through.
I love that. We've only got 50 seconds left, so I really want to ask this question. In what way does the EDFC aim to end the stigma through education, and why is this so central to its mission and vision?
Right. I think it's really important because people don't understand out there. It's such a complex disorder. People don't
Hmm.
understand the complexity. We have to get out there and teach everyone so that they can come forward. Parents, students are a little frightened to tell their parents that they're going through it.
Right.
Parents are a little frightened to tell their friends that they're going through it. We
Hmm.
have to be able to zoom in and also to be able to capitalize on utilizing those with lived experience like yourself to try and help us educate, bring awareness. So we're focusing on the student body. We're focusing right now on the first year, second year, third year, because that's when
Wonderful.
it really peaks. We're trying to keep people in school rather than
Wonderful.
withdrawn because of the stressors.
Individual treatment is important, but so is ongoing support for people recovering from an eating disorder. Dr. Robbie Campbell has piloted a new project specifically to address this issue. So let's talk about that. What exactly is the Harbor Project, and how was it conceived by EDFC as a groundbreaking solution for students and young adults?
I think we have acknowledged that there's such a variety in the presentation of an eating disorder that you need a customized approach. We wanted to work with the university students because we have student health services and we work with the
Mhm.
family health teams because there's often a big medical component to it.
Mhm.
Oftentimes there are electrolyte imbalances, as you well know,
Yes,
cardiac impacts, all kinds of different things. So we work with the family docs and the student health services. And currently we're working with Western and Fanshawe, trying to help them and give them support so that they can follow students through and get them through their grades. So we bring a support team for family docs, and we're also expanding into the community because they have
that's
family
great.
health teams out there. And we're trying to work with them so that no, we're not taking a patient. No, we want to work with someone. We have to have collaboration. We have to have a mutual supportive environment. So it's a shared care model. And so that's what we aim to do. And we think that this is a unique kind of approach in a
Mhm.
way. Yes, we're still trying to get it off the ground. We got lots of way to go. We got to raise money and we got to get some government support and we made a good start.
Well, let's talk about those unique services. That's why when I was researching about eating disorders, I you stood out because I'm like, this is a novel idea. I love it. I have to learn more about it, and I know you're trying to just really get it going. So let's talk about the unique services that the Harbor offers, like clinical treatment, restorative support, mentorship, and social connections. And how does it create a true safe refuge?
I think what we try and make a comfortable environment. We're right on campus. We're at Research Park, but we have a nice warm facility. We're trying to make it so it's inviting, that we have a welcoming person. We look at different therapies and supportive therapies you mentioned, everything from music to art therapy that we
Mm,
have.
love
Looking
that.
at this kind of thing, which is super. Cooking therapy. We've even got the Brescia College, which used to be the old uh, a dietitian school. It's now
Okay.
taken over by health sciences. So they've paired with us and allowing us to use their cooking kitchen to
Huh.
have people actually engaged. And
Wow.
so we've got McCormick's on board trying to get us to look at spices, look at the impact
Wow.
of taste. And we're trying to look at the impact of sound, of sight, of touch, of feel, of being have people involved with food
Yeah.
and make it a positive experience. So it's all of this, including healthy exercise, including eating with others and outings with others so you can feel a little more comfortable. So you've got kind of a relationship therapy. At the same
Mhm.
time, you're meeting with a needed therapist as well. Say you've gone through trauma, and
Mhm.
oftentimes kids will go through the families break up, and it really impacts them like back when they're young
Yeah.
and it
Mhm.
comes forward by the time they get to university, it really blossoms and blooms. We
Right.
have to have them, but we work in conjunction with them, with the team. But we think that the supportive therapies are vital. We really think, and that's everything from like the yoga thing with the retraining, getting back in, because a lot of people over exercise
Yep.
2 to 3 hours a day. And so how do you get them off the mill? So you have to organize and help them organize some semblance of control over their life rather than using the food and the problems they have with it to control life. We want to be able to get them to control this part.
I can't tell you how excited I am to hear that you're doing this initiative. You have really thought about how it does affect people dealing with these disorders in such a unique way. And I want to ask, how can viewers get involved with the Harbor or EDFC to support this life changing work?
I just like them to be able to give us a call. They can give us a call at the harbor. They can check out on the website. And we're in the process, yes, of trying to revamp the website, make everything better. But you can connect with us. You can connect directly here. And I'm still here too because I'm sort of an initial contact with people, assess them. And don't forget, we're able to do assessments on the screen. So,
Wonderful.
like this, we can use the Zoom approach.
Thanks so much for watching.